Okay, guys. Good morning, everyone. I'm really excited to be here today. I'm truly excited to be here again, and I want to welcome everybody for joining us. This is Mind Cafe. Okay. It is a first physical hangout by Lucid Point Africa here in Ado Ekiti, and I am enthralled to partake in this program. Here we're a mental health awareness community, and our unique conversations help us to increase knowledge. Okay, it helps us to teach coping skills, and overall, what we do is that we help one another as a support network to promote mental well-being. So my own name is Ayodeji Yorubu. I am a mental health professional, and I am also the convener of the initiative to combat the effect of drug abuse. I know quite a number of people already here, so I'm glad this is an in-house thing. I hope we'll be able to have a very filled day today. So let's feel free and enjoy today. Before we move on to the conversation, I want to play a short video. I think we should start with this background video. Please let's give ourselves a round of applause.
Punch me, and he would tell me that he would get rid of it, he would get the cockroach out of my stomach. But the way I love this person, he was going to kill me if I said, I never shed a tear. Why?
Wow. So this is a short video. This is not the this is not everything we're talking about today, but it's just an insight into what we might be talking about today. So I want to use this opportunity to welcome our special guest, who is also part of us. One good thing about this community is that whether you're a student, whether you're a medical practitioner, you're an engineer, accountant, it doesn't matter. What matters is that everybody is pro mental health, and we are moving to push the conversation. We are moving to promote mental well-being, and that is what matters. And that's why I'm so excited to be here today. So I want us to welcome Nurse Precious Olarotimi. Yes, come to this special seat. She's a mental health advocate. She has taught me a lot about purpose living. She's so particular about purposeful living. Please help us welcome Nurse Precious. I will start with the main thing. Today we're talking about toxic relationships and how people can deal with this, forms of relationships in the medical, or let me use the word, in the mental health field. You may use the terms like unhealthy relationships or relationships that can affect your mental well-being. But then that's not for me to start saying now. We have somebody to help us in the house today. So Nurse Precious, you're welcome once again.
Thank you, sir.
What is toxic relationship? One. And when can you say somebody is in a toxic relationship? Regardless of your gender, your socioeconomic status, when can you say somebody is in a toxic relationship?
Thank you so much, sir. Good morning once again.
Good morning.
Oh, we're not responding now. Thank you. There's cash prize, though. Mhm.
I want to win.
Okay, I'm very sure that the word toxic relationship is not strange to us, right? So I'm just going to explain according to what I believe and I know toxic relationship is. Toxic relationship is a relationship that damage or drain your self-worth. Any relationship that drains your self-worth, that causes you to lose your sense of identity, is a toxic relationship. And one thing that you're going to see about a toxic relationship is that there is this consistent, sustained environment where there is disrespect, lack of empathy, there is fear, exclusion, and so many manipulation, control. Those are the things you are going to see when it comes to toxic relationship. Manipulation, control, there is fear. Second question.
Yes, in what situation?
Okay, in what situation?
Yes.
When you constantly feel unsafe, when you feel anxious, when you lose yourself so much that you don't even understand the pattern your life is going with. That's where you can see that you are in a toxic relationship. You lose your sense of identity. You no longer pursue your goal because of this particular relationship. You feel anxious all the time. You feel being controlled. all the time. You feel silent, you feel disapproved when you are trying to state your opinion. That is when I say you are in a toxic relationship. Thank you.
Thank you very much. Thank you so much for the applause too. I mean, like, would I say I've been in toxic relationships? I don't know yet, but there have been instances where, particularly, there used to be someone. I won't, I won't give a clue of the identity, but I noticed that there was this huge anxiety meeting this person physically. I guess we were good talking on the phone, virtually, but when it comes to meeting this person face to face, there was a lot of anxiety. And because of that, I would rather not even meet this person. But then we still had some benefits, you know, as as we were two people in a form of relationship. Would you say that was a toxic relationship? I
Yeah,
was in one.
that
you know.
we need to know why exactly you feel anxious whenever you are with this person. Right? That's the situation, right?
No, I couldn't really figure out what the problem was by that time, but maybe with the knowledge of hindsight, now I'm thinking maybe I feel suppressed whenever I was with him. Maybe it was because he had you know, this demeanor that will just kill your self-esteem, that will just kill your confidence. I'm just saying maybe now, looking back, you know. So possibly that was what was happening.
Okay, if that is actually the situation, and then it's actually a toxic relationship. Any relationship where you cannot fully express yourself is actually a toxic relationship. When you cannot express your opinion, you cannot state your perspective, or you constantly feel less of yourself, is toxic for you. The person might not necessarily be toxic because this
Hmm.
person is not verbally abusing you, not physically abusing you. It might be issue with your childhood upbringing or something, or with your self-esteem. So you need to deal with that side of you so that you can enjoy relationship.
About childhood upbringing and self-esteem. So we're saying that if an individual could perceive a relationship as being toxic, at the same time being the contributing factor to that,
Yes, sir.
so-called toxic relationship.
Yes, sir.
Well, this brings me to the next question. What are the factors that contribute to, toxic relationship?
What are the factors that contribute to toxic relationship? I'm going to say this: low self-esteem and past traumas. Yes, because I met with someone and she was saying that, oh, she believes that she deserved everything that was happening to her. And I was like, okay, why did you say so? Why do you believe you deserve everything that was happening to you? She was like, oh, because she has done bad to people in the past. So those people are not responsible for what was happening to her, but she just believed that, oh, she deserves it. She does not deserve a good life. So past traumas or past experiences actually is a contributing factor to this. Then another thing I'm going to say is probably you have witnessed unhealthy relationship. Yes, I was telling someone. I said there was a point in my life that I believed that, oh, marriage is not for me. I don't think I can do this, and it's not my fault because I've actually seen marriages, broken marriages. So if you grew up in a place where there is unhealthy relationship, then it's actually a contributing factor. It's going to, one thing about toxicity is that toxicity is going to rewire your mind. It's going to affect the way you perceive love, the way you perceive safety, the way you trust people. So that can actually be a contributing factor to toxic relationship.
Thank you so much. I would like to shift focus a bit to the participants. Something crossed my mind while she was talking about factors contributing to toxic relationship. Do we think there can be a toxic relationship between a father and a son, mother and a daughter, siblings, people that are related by blood? Okay, okay.
Yes, I would say so. Because a father from a very terrible background would actually treat his son the same way he was treated if he does not unlearn those habits. So
Mm,
yes, toxic
Hmm.
relationship does not have to be a romantic relationship. It can happen even among friends. Sef.
Wow,
yes.
wow. That's some other thing.
Thank you very much. I would love to add to what you just said. I think this toxic relationship actually starts with parents-children relationship because
Mm.
It's that broken inner child, like she was saying, that we carry sometimes into our relationship. We don't even know the difference between love and toxicity because grown, we were grown with so much trauma
Hmm.
Mm.
Hmm.
from the way we were raised.
Trauma of childhood.
So we don't know what love is. We don't know the definition of love. So we tend to see abuse as normal. But until we get
Hmm.
to that point where we have to rewire our mind,
Hmm.
we have to consciously heal. We can't differentiate between this. So I think for me, everything starts with that parent-child relationship. Because like someone said, we're all grown up, but we're still dealing with childhood problems.
Mm.
Everything starts from childhood. That's why I'm so concerned about this
Childhood
parent-child
trauma.
relationship. Thank you very much.
Thank you. Thank you very much. That is very, very hard. Childhood trauma.
Mm.
For childhood upbringing. You want something? You want to say something about that?
Yes, sir. It does not have to be romantic relationship, just like we have said. It can actually be. It's very possible. Very, very, very possible. Why? Because toxicity is not about title. It's not about. I'm careful of using the word title. It's not about title. It's a behavior. It's a behavior of a person. So that's why it does not matter whether this person is your father or your mother or your sibling. So it's very, very, very possible that toxic relationship exists within the family.
But more often than not, people would advise any victim of toxic relationship to leave. So are you saying that, you know, when we are bound by blood, we should leave? You can't leave your parents.
Yeah, the truth is, a lot of people advise, oh, when you're in a toxic relationship, the first thing to do is leave. But we all know that sometimes it's not possible. Why? Because this person might be dealing with might not even know that this is a toxic relationship. Feels normal.
Hmm. Hmm.
There's a way we
Hmm.
can actually normalize nonsense. So the person might
Hmm.
feel that, oh, this is normal. I mean, maybe I'm the problem.
Hmm.
So there's a way you can feel that you're the problem and you don't want to leave. So for me, I think it starts by you telling yourself, by being aware that this is, call a spade a spade. This is toxic. Don't package it. Don't try to normalize it. This is toxic. So when you're aware, then choose yourself. In that kind of case, I will advise that you choose yourself. How do you choose yourself? It's by learning how to
Hmm.
set boundaries. See, boundaries does not mean that you don't want this person in your life. It's just creating healthy distance. We are in same space, but I'm not allowing you into my life because what you say, what you do affects me. So it's something I think is a setting boundaries is a skill that we actually need
What
to
if I
learn.
what if I gain some benefit from this individual and I'm so afraid of losing those we've heard of trauma bound, people in relationship,
Yes,
you know, this benefit I can't afford to lose it.
you need to actually count the costs. You need to weigh it,
Hmm.
the benefit
Hmm.
and your mental health. Because you are not. It's not about you. You are going to bleed on others.
Hmm.
That's one thing. You are going to bleed on others, and the more you bleed on others, you raise toxic people. Toxic people raise another toxic people. Toxic
Generation of
family,
toxicity.
and it goes like that. So you
Hmm.
have to check. Okay, this is because you have low self esteem. Those benefits, self, you can actually become something can become something. I think I went to a secondary school at Trish and a lady asked the question, said, you per saying I should leave my boyfriend. This boyfriend buys me phone, buys me this, buys me that. My parents cannot provide it for me. But at the expense of what? You're still going to make money, millions, billions,
Hmm.
if you can choose yourself first. So I advise you choose yourself first, then set boundaries. Boundaries does not mean that we cannot be in same space. It's just like I'm not going to allow you into my life.
My space.
Healthy distance.
Hmm.
We're in same
Hmm.
space, but I try to keep it. I
I
try
think I get your point
to.
because, in fact, so long you're bound by someone, you're probably not going to, break out. Until you break out, you now see the world and see that I think I'm much more better than this. Because so long somebody is hurting you more than they are helping you, I don't think you can actually break through. That
Mm,
phase, may be awful. That phase may be, really overwhelming, but just a couple of months, and I believe that people will heal and your eyes will be open to better opportunities, better people outside there. At times, when you don't leave some people, you don't see the better people
mm,
outside there for this. And I'm going to ask the next question. We know that generally There is hardly any mental problem or socially deviant behavior or inappropriate behavior that is not affected or caused by drug use. I'm taking us to drug use. Even if it's not directly caused by drug use, maybe as a contributing factor. So, what is the role of drug abuse or drug use in toxic relationship?
Role of drug use. Drug use is actually a big contributing factor. Why do I say this? Drug use affects your judgment. Number one thing, you will think that you are doing the right thing, but in the actual sense you are not making sense. So drug use affects your judgment. It lowers your impulse control. Yes, that's one thing about drug use. When you are under the influence of substance, under the influence of drug, at that moment you don't know what you are doing. Dr. Mike will always say something. I'm glad I can reference him in this occasion. He will say that
And there's someone that can take it back to him.
Dr. Mike will say that one thing about drug use will rob you of your foresight. It will rob you. You can't think future, you can't think anything. So in toxic relationship, when someone is under the influence of substance use, you can't have healthy communication with such person. There's no how you want to even talk to the person about a particular behavior or a particular thing. You can't. The person will constantly abuse you physically. We've heard of people under the influence of alcohol, and they get home, they just beat up their wife and all of those things like that. So, and they just do nasty stuff to people, and they enjoy doing them because at that moment they can't think straight, they don't even know what they are doing. So drug use actually contributes to this. So drug use can create toxicity, and it can further intensify a toxic behavior.
Thanks. Thank you very much. Just less than 24 hours ago, one of my patients came in and you know had a breakdown. So out of everything she said, I picked something, and she just said it by chance. She wasn't even gonna tell us. She said, okay. And he used to beat me then. I mean, he used to beat me a lot. I was like, okay, you were not planning to tell us this? You know, I wasn't going to judge the husband, but on my interaction with the husband, all that was going through my mind is it possible this man uses drug? Is it possible he uses drug? So we can really not, overemphasize the role of drug use in unhealthy relationships, in abusive relationships. And this will bring me to the next question. What are the effects, of the mental health effects on people in toxic relationships?
Thank you, sir. The first thing when he asked the question, the first thing that came to my mind is that the first thing such individual, the victim, we the kind of, how do I put it now, survivor mentality. Let me just survive. That's the first thing that is going to happen to them. They just want to survive. Then depression,
Hmm.
persistent low mood.
Yeah.
I know that I don't want to be speaking medical terms
Hmm.
like that. Depression, anxiety, and that thing
Hmm.
is hypervigilance. You're always just careful. You're careful. You don't trust people. You have
They're always
trust
on the
issues. You're
edge.
always okay. I don't know. Anything can happen anytime. So you're always suspicious of people. You are hypervigilant. You're always being careful. You feel unsafe. Severe anxiety. We've heard people come panic attacks a lot of mental health problems and related problems that can be as a result of toxic relationship.
I don't know if anybody has had any personal encounter and you want to share with us. You know, Unhealthy relationship, abusive relationship. We don't need to mention names or identity, but let's just, even if it is your close friend. Oh, thank you very much.
My name is Miracle Blossom. I work as a mental health professional. A personal example I'll share is friendship related. So I observed that in many of my friendships, I'm the more loyal one. And when I say loyal one, the show of coin. You're doing this to show off. I'm the kind of person that probably sometimes even tries to put my to-do list, reach out to Precious, call Dr. Aya. text this text. Uh, and one of the things I think he did was drain me. Not because I don't want to or consistently show for the people who are important to me, but because I mostly made them lackadaisical about our friendship. So a particular person says, and I quote, you teach people how to treat you.
Yeah.
So you don't necessarily say, oh, sit down. So today it is how to treat miracle 101. Then you start telling your number one, call her every week. Number two,
Buy gift
give
for
her
her.
birthday gifts, you know, and no. But with the way that you interact with them, thank you. With the way you interact with them, they learn. Uh, so one of the things that I'd say that I began to incorporate was first recognize the people that actually pour into you as well and invest more in those relationships. So it helps you balance out. Off the top of my head now, I can remember one person who I know if the world is coming to an end, I can always reach out and I would never feel like a burden. Uh, so the other people are just yes, people that bring color to your life. Because the truth is, community actually brings color, adds color to your life. So the other people are just oh, okay. You know, these people who are in my life have been in my life for years and that they don't pour as much. Sometimes, depending on the kind of relationship I have with that kind of person, if it really hits hard, I can bring up a conversation about it. Okay, so this happens. So don't just say, oh, you don't show up for me or you don't call me. No, it is, uh, I had reached out to you telling you that my boyfriend broke up with me. And I expected that, okay, you know, to an extent, maybe if you'd even reach out and say, oh, how are you doing? Yes, we're not in the same place. Specific requests, don't be a baby about it. You know, specific requests, oh, I expected you to do this, but this didn't happen. That's on one side. On the other side too is understand the people you deal with. There are people, there's someone in my life now who, as much as possible, should apologize. Oh, I know you always do this. I'm so sorry. But there's people that genuinely don't know how to be there. But you see that they're trying to make the efforts. So one, understand the people that you're with to make particular requests. Three, teach people how to treat you. And I think it will help. So I think I shared an example and also
People have to
you know,
treat you.
Yeah, very
shared what I'm learning on
That line.
I'm Dr. Clement, popularly known as Dr. Green.
Oh,
I'm a mental health practitioner as well. I'm a resident in neuropsychiatry here in Ado Ekiti, and I've been
welcome.
practicing previously for a while in Lagos as well. So I think I came pretty late. I just got a call from one of my bosses outside Ekiti to attend this event. I'm even surprised. I never knew something like this existed in Ado Ekiti. I've been part of so many communities since I came here, both creative and medical, and
Oh.
I'm impressed that we have conversations and communities like this around mental health because I am really passionate about it. Yeah, that's a preamble. So I've been listening to parts of the conversation that I was able to get, and I think I came in when we are talking about dealing with relationships and then about drugs and then now to share personal experiences. So I'm trying to bring a perspective from practice now. I've seen so many patients. Here we see a lot of patients and all that. Different kinds of mental illnesses, actual clinical diagnosis from schizophrenia, mood disorders, anxiety disorders, so many. I've also seen people. Part of the reason why I have a passion for mental health is I have, will I say, lived experience. Maybe not. It doesn't have to be yours to be a lived experience,
Yes.
but you've seen people struggle.
Mm.
You understand? So you know how much knowledge gaps there are that need to be filled, and you know how people do a lot of wrong things and all that. So from my experience now about relationship parts, I feel like one thing that we always forget is our first step, especially as Africans, is baby and bathwater. Just throw it all the way. You understand? But one thing that we forget is that relationships can be mended.
Yes.
Can be mended. There are lots of therapy for those of us that are more into therapy. I'm more of a clinician anyway, but I do a little bit of therapy. There's family therapy, interpersonal therapy, all of this. Because one thing about toxic relationships is that some people don't have that insight that I'm a terrible person. You understand? So sometimes they don't even know. In the case of some of us here will know what we call high expressed emotions.
Mm.
Sometimes people do it from a place of love. Like,
Yes.
oh, you're
Mm.
struggling with this, you're struggling with that, you can't do this, you can't do that. They feel like they are trying to protect you.
Mm.
So most of these toxicities, most of our parents that were strict towards, I'm a very rebellious child, I'm still a very rebellious person. I understand now as I'm growing older and about to, get into that aspect of my life that most of these things were from a place of love. You understand? They were trying to protect you. And if you look closely, because I grew up in the barracks, a very rough system, if they had not done some
Mm.
terrible things to me, I'll probably be like
Mm.
the other way. You understand? So most of these things come from a place of love. So it takes a lot of sitting down, discussing, oh, mommy, you did this and I wasn't so happy. Oh, I never knew I was hurting you. But yeah, sorry, now make up and kiss to solve, some of these issues. That's for the relationship part. Then about drugs, we'll not finish that conversation today. But one thing that I just want to chip in is that relationships can also contribute to substance use.
Yes.
One thing about substance use, especially I have this question with my bosses a lot, the psychologists and the consultant psychiatrists as well. Like, we talk about substance like an effect approach, and we're not looking at the causes.
Mm.
You understand? I spent a long time in the creative industry with creatives, musicians, rappers, showbiz people that use a lot of substances. And having conversation, I came to realize why people actually do some of these things. It's not like I know like there are people that just take it for fun, but people have problems with
Yeah.
themselves, with people around them that force them into some of these habits. So I've seen so many patients that would go clean for a long time and then there's a quarrel with their mom, is an issue with their girlfriend, is one time that their wife spoke to them rudely and they had to leave the house and look for a place to cool off. So we have to understand that relationships can contribute and further worsen, substance use. So it's a two-way street.
Yeah.
Mm.
Substance can make you have very terrible relationships, will make you have very terrible relationships. And terrible relationships can also contribute to you having
Substances
substance
problems.
problems. So I think,
Oh,
yeah, in a
okay.
nutshell, those are just the points I wanted to make. Thank you very much.
Because we've started to answer the last question, which is to Nurse Precious. You've carried out quite a number of cognitive behavioral therapy, counseling, family therapy, and the the nursing profession has given you the opportunity to be close to patients and their family members. How do you think we can cope or deal with toxic relationship? I don't know if I should paraphrase. I need to be careful. Okay, because are we saying that we should endure every toxic relationship? But what is your take? I mean, like, if it is coping, how should we cope? If it is dealing, how should we deal with toxic relationship?
Well, we've actually, mentioned a lot of things, and I think I've also said some things. Dealing with toxic relationship is, I said it initially, I said, call a spade a spade. This relationship is toxic. If we are not talking about relationship that pushes you to be better, because of your own is too much, why you always this and that, no, that one is not toxic. We're talking about relationships that drains you, because when a relationship drains you, it can have a lot of effects, and it's going to affect other people as well too. So let us call it that this is a toxic relationship, and make sure that it's actually toxic and you're not the toxic one. If you are the toxic one, seek therapy. Yes,
Okay.
we cover up things too much. We're in an African country. I don't have to talk. Cultural pressure, societal pressure. Yeah, no, I don't have to talk. I've met with a lot of patients that says that, oh, what's depression in Africa? My parent does not know depression. No, you
Hmm.
see, these are the real issues.
Cheer up.
So they can't. They said my parents cannot know depression. Though, hey, if I fail this exam, they will kill me. And those were the things that she was saying. So we actually need to enlighten ourselves about these things. There is something called depression. People can be depressed. And I've heard parents say, when in my days, I didn't have opportunities that I have now. You're saying you're depressed. Why are you depressed? This
Hmm.
and that. I'm like, you
I give you
this.
everything you ever asked for.
You attend the best school, you do this, you do that. Why are you saying you're depressed? I'm like,
Even
okay.
the educated ones, they will say,
Yes,
I
even the
don't. They
educated
will speak
ones.
English. I don't think there is any reason why my child should. I mean, I gave her everything. That's what they say. And you know,
our cultural system, we don't talk about mental health.
Yes.
Taboo here. What is are you going to tell my I'm going to tell my dad I'm having mental health issues? Are you mad?
I mean, are you? Are you?
So these are the real issues. So I think we need to enlighten the community just like we are doing now. I'm sure that we have been enlightened in a little way. We need to further enlighten people as well too. And how do you deal with toxic relationship? This is a toxic relationship. Check. I said in every relationship there is a you and there's a you problem and there is a me problem. Am I the problem?
Hmm.
Is it the problem or the other party? Might not be male, might
Are
be
we both
female.
the problem?
Are we both the problem? Right? Now we said something. I think it was Dr. Clement that said so that you don't have to leave every relationship. Right? Now have a conversation with this person. Is this person willing to change? Let's go see a therapist together. For some instances, the person is not actually ready to change. So in a case where the person is actually ready to change, I think it's a good thing. We could go see a therapist together and know that healing takes time. It's going to take time. This person will not automatically adjust. And somebody mentioned that this person might not even know that they are being toxic. I've seen somebody like that. This person has a strong professional ethics. So the person brought this strong professional ethics to relationship, to a romantic relationship,
Doesn't
and
work.
it can't work.
It has never worked.
It can
Never work.
Person is actually a close friend, and I was even getting scared. Are you sure you're going to marry this person? Just like this, and that. And they had a conversation about it. And now I can say, oh, my friend can marry this person. So we have to tell the person, this is not your colleague at work. So if you can have conversation about it, then I think it's a good thing to do. And just like I said, choose yourself, develop a positive self-concept. Yes, a lot of people remain in toxic relationship because they have low self-esteem. They have this dependency tendency. They depend on people for to fill their emotional tank.
To feel
That not
validated.
feel. Yes, I've seen a particular client, and she enters relationship like like what I don't know. She just enters, and the next thing, I'm like, I know that you did not have that fatherly love. I said, I was there too. I lost my father even before he died physically. He was not there. So I can relate to that feeling of being loved. I want to be loved. But you need to heal from it. You need to have a good self-esteem. A relationship should not define who you are. You should actually know who you are to know who you want to be in a relationship with. A lot of us, we don't even know who we are. We just jump into any relationship and we are defined by whatsoever the person says. So you need to have a positive self-concept, develop your self-esteem, so that when you recognize a toxic relationship, in fact, if you have a positive self-esteem, what do you want to be doing in a toxic relationship? There's nothing you want to even be doing there in the first place, because the people you attract to your life is a thank you, ma. It's a reflection of who you are. It's a reflection of who you are. Very, very important. Now there are some people that it's not even possible. What do you want to be doing in my life? It's not possible.
It's a boldness for me.
It's not possible. What do you want to do in my life? So seek therapy. Don't cover up things. Very important. Don't normalize nonsense. Yes, open up to people. And one thing that I also recommend, it just came to my mind now, is that don't see everybody as being the same. I think one of the hindrances to it getting help is, oh, you're same. You're same with this person. Right? So don't see everybody as being same. Give people benefit of doubt first. I mean, learn to. I had a friend. She had trust issues in her past relationship, and when we got talking, she was also looking at me in the same light. I had to constantly remind her, no, I'm not like that. So sometimes you need to actually be open to healthy relationships. So there's a way you can become so toxic. A toxic relationship can make you toxic, and everybody's toxic. So be open to relationship.
It's been an amazing period, asking me these questions. Please, Thank you so much. Thank you for your
Thank you,
responses.
sir.
Thank you.